So the webinar today is split into two sections. The first section will be touching on serious incidents, and then following that, we will move on to complaints. Um, Predominantly, we'll be focusing on instructor responsibilities, but we'll also be touching on the processes around that. So how instructors play their part in the bigger picture, so to speak, and how and the role you can play in helping to develop and enhance cycle training in your responses to some of these things here. Moving on to housekeeping, please, Mike. So my name's Kieran. I'm Director of Training and Quality at the Trust. I've been an instructor since 2008, prior to working for two different training providers and then joining the Trust roughly 2 years ago. You won't be hearing much from me after this slide. I'm going to hand over to my more capable and able colleagues, Mike, who's head of quality. Again, Mike's been an instructor for an awful long time in this industry as well and worked for multiple training providers before joining the trust in his role now as head of quality. Mike's going to be focusing on serious incidents. And then we're also joined by the fantastic Sarah, who is Quality and Operations Officer. So anyone that's had contact with the Contact Us email address, you've probably come across Sarah in the past there with her timely and helpful communication on that side. And Sarah's going to be covering complaints. In terms of how to engage during the session, the Q&A function is available today. So if you've got any questions as we go through the webinar, I will be monitoring the Q&A. So feel free to type any questions into there and I will get back to you as best I can throughout the webinar. I will try and answer as many as I can. Depends how hard you make me work in the next hour and the number of questions I get through on that side there. The only thing we ask on those questions is please make sure you keep them respectful and professional. It'd be a shame to ruin this webinar with some unprofessional behaviour. So yeah, please keep it professional. I hope that goes without saying. But yeah, I will hand over to Mike then. But thank you once again for joining, and I hope you enjoy the webinar and find it useful.
Great, thank you, Kieran. Great to see so many of you here on a Wednesday afternoon. Thank you for making the time to come and listen to us talk for the best part of an hour. Hopefully there'll be some bits you can engage with as well. I'm just going to pop up the bit I'm doing first, which is on serious incidents. So it's a bit of a whistle-stop tour. We haven't got a huge amount of time. So we're going to hopefully run through it and be useful to you. We're going to start with reporting responsibilities. So we'll set some context. We're going to look a little bit at different types of incidents and have a bit of a quiz using Slido. I'm not sure if Kieran actually mentioned that bit or not, but we're going to interact with Slido. Some of you might have been in a webinar before we've used it. We'll have a little practice and check it works. Then we're going to have a look at what defines a serious incident, which are the ones we like to be reported to ourselves by training providers. What you need to do as instructors and training providers and ourselves at the Trust, what help and support we provide as the Trust, and then very importantly, how we apply learning from serious incidents. So I thought it'd be useful to start by a bit of context as why this is an important topic, serious incidents and reporting in particular, and looking at responsibilities for ourselves, yourselves as instructors and training providers. We know that bikeability, we have some level of inherent risk within bikeability. Despite our best efforts to mitigate this, we know that things are going to happen during courses. And what we need to do for ourselves as the Trust, we need to make sure that everyone working within bikeability, firstly and foremost, we're complying with anything and legal requirements in terms of health and safety, risk assessment, reporting, but also, and very importantly, we need to make sure that we embed what we like to put culture of learning, for instance. It's very much learning and support rather than finger pointing and blame, and we like to think that we do that. We have some specific responsibilities as a Trust in terms of reporting requirements. So there's certain incidents that we need to report to the Charity Commission. For example, these tend to be, more serious instances where there's been basis of significant harm or potentially reputational risk. The Charity Commission will check in that we have managed it responsibly, making sure we take steps to limit the impact of the incident and prevent it from happening again. We also have within our grant agreement with Department of Transport and Active Travel England, we have to keep them abreast of all serious incidences, actions and learnings, and sometimes in the more serious of cases, then they need to brief ministers and help with communication lines for us. Failure from us to report up the line can potentially have serious consequences for the bikeability program, which is why we ask you, right the way down from instructors all the way, as soon as things happen, if you can then keep track of them, report them, and then it flows back to us. That makes sure we comply with all our responsibilities. So in terms of instructors, your responsibilities is very simply, basically, if something untoward happens on the course, something unusual, first instance is to speak to your training provider about it and say, is this something that I feel like we need to report? And if so, then follow their procedures, basically. And it could be that these are, written bits of paper, or these days it's more commonly on computer programs or systems. But it is really, if you think something, hang on, I'm not sure, then ask. And then generally, if we report it, it's better, basically. And for training providers, it's really important that they keep kind of accurate records, detailed records of everything that's reported, even though the ones that don't have to be reported to us. It's very useful for spotting patterns that may occur, and then helping them. Future, don't talk about this a little bit later on, actually, and really important for training providers, and we speak about this all the time, is just reporting what we call a serious incident, which we'll talk about this a little bit in just a moment, to ourselves at the trust, and that's within 72 hours. And that 72-hour question comes up quite a lot. And it's not 72 hours from when the incident occurred. It is 72 hours from when the training provider is made aware of it. We realise sometimes we need a bit of time to investigate what's happened, why it's happened, before you necessarily want to contact us. But yeah, that 72 hours is in there, again, because we have requirements to report certain incidents within a certain time frame. So that's why we have that time frame there. I think it'd be quite helpful now, I think, when we're talking about the different type of incidents that we have. So we've talked about the incidents that happen to you guys as instructors in the course, and then what you need to report to training providers, and then potentially what training providers need to report up to us. So I thought running through a few scenarios using Slido could be interesting, and we'll see what responses we get. So hopefully this will work. Let's give it a go. So we'll call it quiz time. So I should also say, these are all anonymous there. Please just pop your answers in and we'll see. It doesn't matter if they're right or wrong. It's more for discussion points. So the first scenario, let's hopefully, again, you can all access this. Again, it's the same. If you've accessed it already, the question should just change and you should be able to see it on your phone. If not, please scan the QR code or use the slido.com webpage and do it. So here's the first one. So a rider feels unwell during training and returns to class. They do not take part in any further training. We've got a little bit of a split opinion here. So does the instructor need to report this to training provider or not? So I'll let a few more votes come in. So yeah, we're getting definitely a majority saying you do not need to report, which I will confirm that's the right answer. This is to do with attendance and course numbers as opposed to a reportable incident. If a rider just drops out, we would not expect that to be a reportable incident. And then similarly, this one is probably going to be quite an easy answer. So the same scenario, but does the training provider then need to report this to the trust? It's an easy one to start. So yeah, I can see everyone's coming in now. Yeah, this is not anything that we feel we need to know about. So I will move on to the next one. So a school informs you as an instructor that they've received a consent from a child who does not attend their school. Is this something that you feel you need to tell your training provider about? There you go, you can see the answers flowing in so far. Mostly yeses. Yeah, so 93% are saying yes, and that is, yeah, the correct answer. Obviously, this happens a little more frequently now using digitization, not that often, but it does happen where things get mixed up, and sometimes the wrong QR code or the wrong email can be entered and the consent comes into the wrong school. And yeah, that is something that we would definitely want you to tell your training providers about, because if personal data is shared, there's potentially a data breach and we may need to report it ourselves to the ICO. So on that tilt, do you think that the training provider should report that to us at the trust? I think I might have given a clue just a minute ago to that one, sorry. yeah, again, big majority. Oh, interesting. Yeah, it's actually not quite as big a majority, but oh, it's changing. Let's let a few more votes come in. Let's just see. It's interesting. Okay, so that is actually, yes, Martin, no, this is one where it's definitely a learning point because we would very, very much like to hear about this as soon as possible, basically, because if it's happened to one consent, there's a possibility that something has gone astray in digitization or through some other means where personal information is potentially being shared that shouldn't be, and we need to step in and fix it. It's to say it doesn't happen very often, but it has happened a couple of times, and we need to basically move on it as soon as possible. So please do, instructors, if you see this, report this to training providers. Training providers, let us know this one as soon as possible, basically, and we can fix it. Moving on, number 3. Here's one that happened not very long ago, actually. So rider fell off their cycle, said she was okay, finished the session, goes back into class, and then the next day you hear she had to go to A&E with her parents because she had an arm injury, which actually turned out to be a hairline fracture. This is good news. Everyone is saying yes, they need to report that. Excellent. And then how do you feel about training providers reporting that up to us at the Trust? Oh, there we go. So yeah, the majority for reporting to us actually that yes, we would like this one reported to us, please, because they have gone for outside medical attention, and the fact there's a hairline fracture, that's a significant injury. So yeah, we do definitely need to know about that one. That's kind of yeah, there's always shades of grey, but generally speaking, if there's been some outside medical attention and there's a serious injury, then we definitely need to know about it, even if it happened kind of outside of training as such, or the accident probably occurred during training, but yeah, they went to medical attention afterwards, if that makes sense. Here's another one that happens fairly regularly. Car pulls out of a junction and gets really close to one of your riders, so a near miss. As instructors, are you telling your training providers about these? There we go. So again, overwhelming majority saying yes, yeah, please do. This is important in terms of reporting near misses. Do definitely need to be reported up to your training providers. But training providers, are they then needing to report these to us at the Trust as a reportable incident? Here you go. Okay, yeah. So the majority of them, yeah, got that one correct again. Yeah, we don't need to necessarily know about these. It's really important that training providers keep a record of them, and because understanding, near misses, it can help us all learning how we can potentially reduce future incidents and accidents. So we don't need to know about every near miss. We do ask training providers to keep a log, and we will ask to have a look at it when we come for an EQA visit. So yeah, moving on to the next one. Here we are. Not a very nice, unfortunately. The instructor you work with has an allegation that they have touched a rider inappropriately. That's safeguarding concern. So yeah, overwhelming 100% yes, that needs to be reported. It's yeah, regardless if it could just be an allegation, but yeah, that needs to be reported straight away. And do training providers need to report that to us? And again, majority are saying, yeah, that is a definite yes, please. Yeah, safeguarding concerns do need to be reported up as soon as they can be. They're not always the easiest to deal with, but it's really important that they are dealt with in the. We're not going to go deep into safeguarding today. There's another whole webinar coming, maybe next month or the month after, to do with safeguarding. But yeah, please do report these anything around safeguarding concerns to us as soon as possible. Okay, number 6. Riders collide while snaking back to school. No injuries, but a cycle's damaged, so the group walks back. Is that something that as instructors you'd report? Yeah, again, I think most of the votes are in. So yeah, most people say yes. Instructors, you should report that to your training provider. Yes, I think that's something where you've got a damaged cycle. You know, there's been a collision. That's definitely not something you want to brush over. Hang on, my screen is not working. 1 second, sorry. Was that gonna? There we go. Phew. With the same example, is that something training provider needs to report to us at the trust? Split vote, not too split. No, majority saying no. Let's just wait for more to come in. Seems to be about 20. Seems to be that's it. No. Yeah, again, that's right. Yeah, this isn't anything. Not necessarily, it's not a reportable incident for us as a serious incident. No, that's just one for the training provider. Because, however, you know, if there was a collision and an injury, then potentially it would be. But just with a damaged cycle and the walk back, no, that's not necessary. Here's one that hopefully doesn't happen very often. So a driver of a van pulls over to the side of the road and threatens you, the instructor, in front of your riders. Is that something that you would want to report? Definitely, yeah, 100%. Potentially, depending on how the incident unfolded, you may even want to report it to the police as well. It's just, yeah, depending on the level of intimidation, threats, etc. How it. Ideally, as instructors, you want to be de-escalating those incidents rather than escalating them. But what do you think about then the training provider having to report that to us at the trust? Yeah, I was thinking this one might be a bit split. There we go. So where are we going to end up? Nearly 50. That's our closest split so far, I think, isn't it? Oh. I think, yeah, the no's have it just, which again, this is one of those ones where it's a potentially slightly grey area. If it's, you know, you have to use a bit of judgment call here in terms of if it's a short incident and doesn't escalate and it's a threat and then you feel like you've dealt with it, I would report it to the training provider. They don't necessarily need to tell us. If it escalates and becomes very intimidating or aggressive, there's potentially other members of the public involved, the riders feel scared, potentially the police are getting involved, then yes, we would say, please tell us about it. So it's, yeah, a maybe, but it kind of, there's one that says not always crystal clear, basically. We're going for time. Let's move on. We've got a couple more to get through. I think we should be okay for time just. So a rider crashes into a fence on a playground, scrapes her arm, and then is treated by the school first aider. Interesting. Again, it's, yeah, slight split. That's quite an even split. Again, I would say that this is one that you do need to report to your training providers because there has been an injury. I know it's treated by the school first aider, but there still has been an injury that's occurred during training. So yes, fill out an incident form for that one, please. How about reporting that one up to us at the trust? Does the training provider need to do that one? Again, my screen's not working. There we go. Sorry, try that. Yeah, there we go. That's correct. Basically, yeah, training provider doesn't need to report this to us. As basically there's, you know, no outside medical attention. It's probably just a scrape, easily dealt with yeah, a plaster and a few reassuring words, hopefully. So yeah, no need to report it to us. It's an interesting one. A rider who's from SEN school had an emotional outburst, bangs her head 3 times against the pavement. She was wearing a helmet and there was a support worker present, but do we need to report that? Yeah, everyone's in agreement. Yes, we do. That would be definitely something to report. Does the training provider necessarily need to report that one to us at the trust? Again, a bit of a split here. But yeah, generally speaking, if again, this is a slight maybe, but generally no, I would say we would not need this one as it stands there, unless it had become an escalated incident and there's potentially she caused, a bit more harm to herself, or again, members of the public potentially got involved or witnesses. But yeah, as it's described there, it would be a no need. And then last one, a member of the public makes inappropriate remarks to a rider when walking past a training site. Yep, everyone's in agreement. Yep, need to report that to training provider. Does the training provider need to report it to us at the trust? Again, you're mostly in agreement that, yeah, no, again, I'd say this is, yeah, generally no again, but just depending on if you overheard the remark or if you were then slightly concerned that it was something where the rider may have known the adult and there's some kind of safeguarding concern there. But that would be okay, that's something we maybe need to report up. But no, generally speaking, if they do it and walk past and gone and it's just a throwaway line, then no. But yeah, certainly make a note of it and report it to the training provider. So yeah, that's my sort of 10 questions come on the screen. Can you change? There we go. So as you can see, it's not necessarily completely clear. It's really hard sometimes to say, well, actually, sometimes a judgment call. So we would always say, if you're not sure, just ask instructors. You can ask your training providers whether, do I need to report this? Training providers, you can come and ask us ourselves at the trust. So we're not quite sure, and we have that quite regularly, and we're very happy to help. We kind of put the kind of main categories of incidents that we consider to be reportable to us are obviously safeguarding. We just talked about safeguarding concerns, allegations, health and safety incidents. They're generally accidents, falls, crashes where medical attention, external medical attention is needed, generally with some kind of significant harm to like riders, instructors, or members of the public. So we touched briefly on data breaches. These are a little bit more frequent now. We're using digitalization and they are really important. So if you have any concerns that anything has gone astray or awry with consents or information, please do let us know as soon as you can and we will help fix that. And again, reputational risk are the other ones. You say anything involving public or any instance where you feel that Bikeability's reputation might be slightly at risk, then yeah, we need to know about those as quickly as possible too. But again, as I said previously, if you're in any doubt, please ask. In terms of what we need to do, I don't want to spend too long on this. It's just to give you a bit of an idea in terms of as instructors, your job is to deal with the instances they happen first and foremost. So we're not going to go into that now. That would take a long time to go through all the different ones. You guys do a great job of managing all these situations. We just then ask that once everyone is safe and the incident is dealt with, then it's time to fill out the paperwork and complete the forms as required by your training provider. Training providers have to follow their own procedures. That might include getting reports from other parties. They might have to they will have to. They're just contacting various different people depending on the incident. It could be that it's schools, parents. It could be LADOs, police, or RIDDOR, which is reporting of injuries, diseases, and dangerous occurrences. That's the one. And that basically is for some incidences, such as, for example, maybe a rider had a crash on a training site, an ambulance was called to the training site and took them to hospital, then that would require reporting to RIDDOR. So would if, say, for example, an instructor fell off and then had more than 7 days off work as a result of an injury at work, that would also need recording to RIDDOR. That's a training provider / grant recipient responsibility, and we can help with those as well if you're not sure. Us at the trust, the training providers also, they may need a bit of time to conduct their own investigations, and look into it a bit further to find out if it's a reportable incident and how it happened and what they need to do next. And then once they've made that decision, then they need to tell ourselves and the grant recipients and send through all the necessary paperwork, which can be not just the incident form. Sometimes that includes what will generally include risk assessments. It can include witness statements. And yeah, we just need as much paperwork as we can, basically. We are there on hand to basically help and support as required, and then do what we need to do at our end, which we touched on earlier in terms of reporting to like trustees, Active Travel England, Charity Commission. But what we'd like to get across from today's webinar really is, it's a supportive environment. We're there, so please do come and use us, ask questions. We're there for help and guidance in the initial process, in terms of, does it meet the threshold for reporting? Have you done everything that's needed? Have I contacted all the right people? Have I completed central necessary documentation? We have got model incident forms if they're needed. At the trust, we can also set up, in the more serious instances, sometimes we want to set up media monitoring alerts, where if things pop up on socials or the internet, we've got a heads up and we can help head them off. We can help with agreed lines of communications, potentially to parents or the press or the public, depending on what's happened. And we're also around to help with support and advice following incidents, basically. So that could be that you potentially need help writing a safeguarding risk assessment, or need some training or signposting to training that with our guidance that can help with preventing reoccurrence of incidents with a bit of instructor training or CPD. We can also offer help and support. Some of these incidents can be a little bit traumatic, and so we're here to help and support instructors who've potentially been affected by something they've seen or witnessed or been involved with. Again, same at the bottom, the culture is not finger pointing and blame. It's very much one of support and learning. Learning is really important, basically. It's we're trying to embed a learning culture, helping us all understand what happened in incidents, why they happened, to basically help us prevent them reoccurring. It's really important to keep records. I mentioned this earlier about looking for patterns, because that helps us with reoccurrence. So, for example, we've noticed that there's been 3 incidents on the same downhill stretch doing a left in, basically, turn, and then we might have to look at, are people signaling when they should be maybe spending more time trying to control their bike? Is that something we need to look at? It could be there's a pattern of near misses at a junction. Should we be using that junction? Probably not. Are there any other actions we can take to reduce risks of the same incident occurring again? Things like we can look at specific hazards and we can update risk assessments, circulate them to all instructors. Near misses can potentially give us a need to look at instructor positioning without necessarily needing to move junction. If you just have one, potentially you have an incident with maybe a loose wheel comes off on a cycle, so it's not attached properly, and then there's a crash and maybe an injury. Do we need to look at bike check refreshers? Do we need to look at CPD for bike maintenance for instructors? Do we need additional training on GDPR to help with data breaches, so everyone's really aware of what they are and what we can do to prevent them, and what we need to do when we find them? At the trust, we take all the information we get. We have, like I said, I didn't actually say at the beginning, actually, we don't, considering the amount of training we do, we get remarkably few serious incidents, which is good, but we do need to make sure we deal with the ones that come through correctly and learn from them. So we will take all the information we've got and we help that to inform our quality plan and then our CPD plan. You'll find that some of the webinars we're putting on over this course of this year have been informed by what's happened over the last year's incidents, and training providers should also be doing the same, and taking learning from all the incidences and using that as part of their annual quality plan and feeding back to us through the annual renewals, which then helps us with the process. I think I've probably talked longer than I should, so I better wrap that up. So thank you very much for listening. I hope that was helpful and useful. Please do ask any questions that you want to, obviously in the Q&A, and if we don't get to them, then obviously please do drop us an email. Just get in touch via Contact Us, and myself and Sarah will be very happy to help. But on that note, I'm going to move on from incidents over to complaints, and over to you, Sarah.
Thanks, Mike. Yes, so in this section of the webinar, we're going to be taking a look at complaints. We'll just quickly look at what we consider a complaint is. We've got a Slido question, and then we're actually going to look at some of the complaints we've received in, just to give you an idea really of what people complain about. Briefly looking at how we address complaints, what the stages are, and then sort of looking at, very briefly again, reporting and the learnings we can take from those complaints. Can you move on, Mike? Thanks. So before we start looking at the examples and the different complaint themes, we probably just need to have a check-in about what actually is considered as a complaint. So as you can see, a complaint is simply an objection to something that is deemed unfair, unacceptable, or not meeting expected standards. And I've popped a few reasons in there why people complain. You know, they may feel unheard, unsafe, excluded. It could be due to communication or miscommunication and just unmet expectations. A complaint isn't always going to arrive in an email marked complaint. It could be something as simple as someone saying something wasn't quite right or it didn't meet their expectations. It could be a comment made in passing, a parent saying they felt something was unfair, a rider looking a little bit upset, telling you something that's happened. So really, complaints can be formal or informal, sometimes subtle and sometimes very clear. And it's important to be reminded that as we go through some of the examples, there are two sides to every story, and what is reported is just one perspective. And we often find that actually when an instructor's account is added, we get more valuable context. And it's also worth saying at this point that whilst we're focusing on the complaints and when we have a look at the examples, you know, it sort of it can feel a bit, well, it's negative, isn't it, a complaint? We do receive lots of positive feedback. We do get riders and parents telling us how brilliant instructors were, how supportive they've been, how patient, they've built confidence. But it's just that people are more likely to speak up when something goes wrong, or you know, they weren't happy, rather than telling us more often about the positives. So if we move on to the next slide. We have a bit of a Slido poll here for you. So just as part of the training provider annual renewals, every training provider is required to report on the number of stage 1 complaints that they have received and resolved that haven't been escalated to us at the trust. They must also tell us how many of the complaints involve a rider with SEND. To set the scene, last year, 121 complaints were reported, which does sound a lot, but when you realise that that comes from over 464,000 attended deliveries, we're looking at sort of 0.03%. So complaints are generally rare. So these are the five categories that are reported, sorry, 4 categories that are reported on. If you can rank them from most common to least common, and then we'll see what the thinking is. You may well have experience of complaints and sort of be thinking what you've had most in of. Okay, right, we've got 2 sort of which are higher rated. So the categories are actually ranked, not quite as what the thinking's showing. At 44%, it was actually instructor conduct that was the most common. Then exclusion from training. We did have a category called other, but that's quite general sort of, we didn't include that in this poll. Then damaged equipment, and yes, safety is the bottom one. Of all these complaints, 16% involved a rider with SEND. We've seen the same trend for the past 2 years, but just with an increase in numbers of the reported complaints. So we're going to have a look at some examples now from the actual themes. So exclusion from training. So this is all instances where the rider was not asked to continue training. Sometimes it's about confidence, sometimes it's to do with an SEND need, misunderstandings, and sometimes it's just the way something's been said. For example, a rider might be told they're not ready to progress onto level 2. What seems to be the issue is just how the message is conveyed. I'm just looking through the examples there. You can sort of see it's confidence, talking about failing, not participating, different examples. What's interesting actually there, and I did include this one, is the last one there, which says rider was not allowed to take part as BMX only had one brake. Now, whilst a BMX is fine to use for bikeability if it's got two brakes, obviously the one brake is the issue. And again, that may be miscommunication to the parent. So really, I think these situations sort of remind us why language, tone matter so much. Small wording choices can be interpreted as judgment, embarrassment for sort of being failed or not progressing, even when that was not the intention, because it's to do with actually capability of riders. Lack of reasonable adjustments as well is often an exclusion from training. And hopefully with Digi now, we are getting more SEND needs logged, and that can be then incorporated into the planning of the sessions. And again, this is where two sides to the story is important. Often when instructors ask, it's due to safety or managing a group that these decisions have been made. It's just perhaps the way it's not been received by the child. So the key learning here is probably to ensure riders feel supported, informed, respected, even when it's difficult, even when it's necessary to make the difficult decisions. Moving on to the next category. So the instructor conduct, which is the biggest reported category of complaints. So this is essentially anything to do with behaviour, tone, language used by instructors. Examples here include things like sarcasm, shouting, jokes that didn't land, comments that came across as dismissive, unkind. So looking at the examples, we've got rider was told he was cocky, instructor shouted, "You're dead," because rider wasn't looking properly. You're acting like a 5-year-old, get a life. These complaints can feel personal because they relate to how an interaction made somebody feel. Even if the instructor's not meaning any harm, the perception is what matters in these instances. This is why it's important to just be aware of sort of professional, respectful communication. It's very much highlighted in the instructor code of practice. So definitely worth having a look at that. SEND awareness is also really important. Do make sure that the SEND training's been completed. It is part of all the new level 2 qualification, but it's available to have if you did it a few years ago, go and get a refresh on it, because what can feel like a harmless comment to one child can be actually really upsetting to another. But please do remember, we also do receive really nice stories about instructors, and this is just a small percentage of complaints that have come in across a large number of deliveries. Moving on to the next category. So safety complaints are quite interesting because these tend to often come from people outside the session, a parent passing by, member of the public, even another teacher. They tend to be more about road position, manoeuvres, how the setup of the training space has been done, even a minor injury. It's more about the perception of risk. So it's why having clear routines, correct signalling, good session setup is important. It's giving confidence to the parents and the public that the riders are actually being looked after whilst on the course. Moving on to equipment damaged. So this category includes any situation where a rider's equipment is damaged during training, for example, bursting a tyre, removing a brake incorrectly, breaking a helmet. These complaints can often arise from good intentions, like when trying to help with a quick fix on a bike. The key is knowing when to persevere and when to step back, and when to escalate, if at all it's possible to escalate a fix onto somebody else. Clear communication on this side also helps set expectations, especially if you're making adjustments. If a fix has been necessary, please remember you can let the parents, carers know via the cycle and kit check feature on the instructor app. Plenty of space to just give the parent there or the carer an update on what's happened, what actions were taken, and perhaps what recommendations you make. They receive a copy of that email then, and the training provider will as well. So hopefully that's given you a good overview, although brief, of the types of complaints we've had in. If we can move on to the next slide. So we have our own complaints process, and the complaints escalate through 3 stages, starting with the training provider grant recipient and progressing then onto the trust, with appeals then going on to Active Travel England. So training providers are responsible for responding to the stage 1 complaints. Any complaints that we get in to the trust, we always direct them to make contact with the training provider or grant recipient directly. The majority of these complaints stay at stage 1, and that's due to early empathetic communication coming from the training providers, responding to that negative experience, turning it into a positive resolution for the person complaining. If the complainant was to feel that actually the complaint hasn't been satisfactorily resolved by the training provider, they are quite entitled then to escalate it to a stage 2 with us at the trust, and that would be investigated either by Mike or myself. If after that this complaint is still unresolved, it would then progress to a stage 3, and that's where it's investigated either by Kieran or Emily themselves here at the trust. And the last stage that is available is an appeal directly to Active Travel England. We don't have many stage 2 complaints, and rarely get a stage 3. A lot of this, stage 1 complaints are dealt really effectively by the training providers. So we're just really grateful that they stay there at stage 1. Moving on. So it's a training provider's responsibility at their training provider annual renewal to report the stage 1 complaints. And this is where we get our numbers from, as well as the ones we do collate numbers at our end as well. Any stage 2 free complaints received, we do inform Active Travel England as well. But all this information really helps us spot emerging trends. It helps us to support training providers with development. We can identify what training or support might be needed in the future. And it also shapes our annual report for the trustees and Active Travel England. So learning from complaints. When something does go wrong, the most important question is, what can we learn from it? Nobody wants to receive complaints, but it's kind of inevitable at some point that somewhere in life you will have a complaint. We really do see that every complaint is just an opportunity to review what's happened, understand why, think about whether anything needs to change, whether it's a process, a policy, communication style, or even additional training. Learning from complaints can really help ensure that the riders are having the safest and best possible experience, and it helps reduce the risk of similar things happening again, and then just goes on then to really strengthen the quality of the bikeability delivery. There's reflective questions which you could ask following a complaint, sort of like I've added 4 there. How might the rider have experienced the session differently from me? What signals might I have missed? Which would be really applicable for any SEND complaints. Was my communication clear, age appropriate, inclusive? Thinking about some of those jokes that may not actually land well with the younger generation now. And did I adapt appropriately for SEND needs? You know, do I need to go back and have a look at that online training? So finally, to close, oh, gone too far, Mike. We do have more information available for you. We have the serious incidents reporting and the complaints web pages on the professional site. We've got guidance on there for handling complaints, goes into a little bit more detail. There's previous webinars on there, which are more process driven outlines of how to go through complaints and serious incidents. We have the complaints policy on the website, which again, it goes through all the different stages that we have. The instructor code of practice. Through the instructor renewals this year, we have actually introduced a tick box to just to make aware for all the instructors of the code, and they must tick it saying that they have read it and acknowledged it. So please do take the time, even if you're here from a training provider perspective, take the time just to read through that. You may have your own policy actually as a training provider, but we do have one available. And obviously your own training providers' complaints policies. Be aware of the procedures, and talk to your training providers if you feel like there's any necessary training which would help you at all in your delivery. We are available. Please do feel free to give us, drop us an email, give us a call. We'll get back to you and help support you in whatever you need with regards to a complaint. And yes, complaints are important and we absolutely do need to take them seriously, but they don't represent the whole picture of all the work that is being done, which is generally fantastic by the instructors. So thank you. Thank you for your time.
Thanks, Sarah. Thank you, everyone. That was really helpful and a great overview of the complaints. To say it's very much a whistle-stop tour, but I think it's really interesting to see the different categories and the different examples. It's certainly food for thought. Kieran, are you still there?
I am indeed.
So you've been beavering away in the background answering questions. Are we up to date with everything? Have you been very efficient?
We are up to date with questions, so thank you everyone for using the Q&A. Send your questions through. I have been answering them as we go through. I think a lot of the questions were quite individualised, but I have put the answers in there for everyone, so they're quite visual for everyone. I think one of the big questions was, why do training providers need to report within 72 hours? So that's part of the wider picture for what the trust then has to do. So from our perspective, we want to support training providers as much as possible, and that's what Mike and Sarah's role is. So training providers don't feel isolated and have to do everything on their own. We can provide some guidance and support around that. But also we've got our own reporting that we have to do potentially to the Charity Commission and Active Travel England as well. So that's why it's important that that 72 hours is met by the training providers, because it enables us to report in our time frame but provide the support that's needed as well. The only other one was just about the recording, whether this will be made wider for the instructors that couldn't make it today. So yes, it will be. A link will be made available in the next newsletter. So
they generally go up on the professionals website. There's a section on the professionals website now where all these monthly webinars have been posted. But yes, that'll go out in the next newsletter. Thank you very much, everyone. Great to see you all, and we'll look forward to next month's webinar.